the impact these activities have on population health. The National Coordinating Center for PHSSR is using this award program to develop more junior investigators and as well as expand the evidence base for PHSSR. A brief overview of the program. We will have 10 $10,000 awards available. So we'll have it up to a maximum of $100,000 to award through this program. Each award will consist of two $5,000 payments. One will be transmitted at the project startup, and the second will be delivered after Phase 1 deliverables are submitted to the National Coordinating Center. Eligible applicants for this award program are doctoral dissertation candidates and also junior faculty who are interested in conducting public health services and systems research. Some key dates and deadlines. October 13th is the deadline for the proposals. That will be at 3 p.m. Eastern Time, and you should be able to log on to my.rwjf.org and find the online application system. We intend to announce our funding decisions on November 18th this year, and we intend to start the awards on January 1st of next year. Anyone who is awarded a dissertation or junior faculty award will be expected to attend the Keeneland PHSSR conference, which will be held April 17th through 19th of 2012. And the last key date will be July 2nd, which will be when the invoice and deliverables for Phase 1 will be due. Let's quickly go over the eligibility criteria for doctoral dissertation applicants. You must have already completed all necessary prerequisites to begin the research project, including being advanced to candidacy. You must have the written support of your dissertation or equivalency chair, and as well as a PHSSR expert mentor. And you must have a U.S.-based college or university agree to be the award recipient and administer the subcontract between the University of Kentucky and that college. You must also demonstrate the ability to complete the deliverables in the stated time frame. The eligibility criteria for junior faculty applicants is very similar. The only difference would be the first criterion, which you see there, is that you must be within 3 years of your initial faculty appointment to be eligible for the criteria. You must still have a U.S.-based college administer the award. You must still demonstrate the ability to complete the deliverables in the stated time frame, and you must still work with a PHSR expert mentor on the project. Your proposed research aims should respond to the PHSR research agenda, which you can see the hyperlink is available here on the PowerPoint. And we also encourage the use of data sets from the National Library of Medicine's Health Services Research Resources database, and you can see a hyperlink there as well. Both of these documents are available through the UK Dissertation and Junior Faculty Awards Program website, which you can find on publichealthsystems.org. Just to briefly go through the deliverables, during the award period, you will be expected to complete the project research plan and a literature review. You will be expected to attend the 2012 Keeneland Conference, participate in any awardee webinars hosted by the National Coordinating Center, and submit any timely information requested by the National Coordinating Center for progress reports to our sponsor, the Robert Wood Johnson Foundation. After the award period, we would like to encourage any awardees to provide documentation of applications to present their research findings at a national or regional conference other than the Keeneland Conference. We'd ask that you continue to participate in any webinars that we host, and that you submit at least one manuscript to a peer-reviewed journal on the research findings of your project within 12 months after the end of the award. If you document, we also ask that you document any additional methods of dissemination. And now I will turn it over to Dr. Rick Ingram, who will give you all a brief overview of public health services and systems research.
Thanks, Jay. We're just going to really quickly kind of what the scope of PHSSR is and kind of some key focus areas of the new research agenda that's been developed in conjunction with some of the various funders of PHSR and the various interest and practice groups that have kind of have a stake in the game, if you will. So to reiterate what Jay had said, PHSSR is defined as a field of study that examines the organization, financing, delivery of services at the local, state, and national levels, and also the impact of these services, these activities on population health. So really we're looking at not just kind of the organization and finance and delivery, really want to see kind of how do these things impact health. Why study public health delivery systems? Well, there's really two salient points. First of all, the data doesn't exist. 2003, the IOM report, The Future of the Public's Health in the 21st Century, concluded that, while the IOM committee had hoped to provide specific guidance, elaborating on the types and levels of workforce, infrastructure-related resources, and investments necessary to ensure the availability of services to all the nation's communities, that data does not exist. At best, evidence is limited. And there really is no agenda or support for this type of research, despite what they recognize as being a critical need for such data to promote and protect the nation's health. So really, the IOM recognized that it was a critical area to research, but it hadn't been done yet. And that kind of really helped add impetus to what was already a burgeoning movement to study the public health system. And really I guess the lack of an investment in that initial stage in public health, system delivery is kind of really, I think, illustrated nicely by this fact that for every $100 in federal health research spending, less than $1 is devoted to delivery system research. This really speaks to the need to build the field, and with these mini grants, we really hope to kind of build the foundation from which we can really kind of keep pushing PHSSR along. And it really is a burgeoning field. It's getting some traction. This is demonstrated by our next slide. And in the Affordable Care Act 2010, it did allocate money for researching on the optimizing delivery of public health services. If you read under Section B.3, research supported under this section shall include, point 3, identifying the effective strategies for organizing, financing, or delivering public health services in a real-world community settings, including comparing state and local health department structures and systems in terms of effectiveness and cost. So really there was this kind of understanding that there is a need to look at how the system works and how it impacts people. And really, if you look at kind of this next slide, talks about PHSSR and the scientific continuum. We kind of know to some extent what works, intervention research. We know about efficacy. We've got these controlled trials, categorical services, and we have the Guide to Community Preventive Services, which suggests, kind of what works. That's intervention research. We also have, what we've not got so far really is services and systems research. That's what we're moving towards. This is kind of how to implement what we discover in intervention research into the real world, looking at funding levels and mechanisms, organizational structures, workforce and staffing patterns, information communications infrastructure, law and policy, how it all works with healthcare, how do we get to at-risk populations, what are the quality and effectiveness of different policies and different procedures, cost efficiency, return on investment, how do these systems and services kind of activities impact equity or disparities, and again, how does it impact population health in the end? So in order to kind of better focus our efforts to promote PHSSR, we convened with a whole bunch of our funders and kind of our advocacy groups and other folks. Some attempts to create a new research agenda for PHSSR. We kind of looked at the one that was created by Lenaway and some other folks in 2000, I think, maybe 4 or 5 it was, as well as the PHF research agenda, and kind of wanted to revisit those and see which points were still relevant, which points weren't, and kind of what did the practice community really think we needed to look at. And we looked at 4 focus areas. The first focus area is workforce, and kind of some of the really, I think, salient questions we found in workforce were, what is the current composition of the workforce? There's still some question as to what the proper way to define the public health workforce is. Then there's a question of what are some optimal staffing patterns? What is the optimal kind of nurse to let's say, nurse per capita ratio to make sure that nursing services are provided adequately and properly. How can the public health system agencies improve recruitment, retention, and training of their employees? How can we maintain workforce capacity? As I think a lot of you are probably familiar with, there is kind of this, to some extent, looming problem of a public health workforce shortage. People are going to get older and retire. How do we kind of maintain that capacity in the face of these demographic changes we're undergoing in the workforce? And how will credentialing impact public health? Those are kind of our workforce focus areas, or some of the salient points, rather. Focus area number 2 was structure and organization of the public health system and agencies. One of the key questions is, what is the best organizational structure for efficient service delivery? And not just efficient service delivery, also effective service delivery. Another one is, how does regionalization affect health outcomes? There is some movement in the public health field to having agencies perhaps share services or have memorandums of understanding where an agency that doesn't provide a service can have another agency who's in a close proximity to provide that service, and kind of they enter into a joint agreement that that service would be provided or be available to rather the populace that the agency that doesn't provide it serves. So how does that affect health outcomes? Is that an effective strategy to serve the public? How do we build meaningful collaborations for service delivery and positive health outcomes? This could be collaborations with other agencies or other system partners, nonprofit agencies, hospitals, places like that. And then how do the organizational characteristics of health agencies affect their choices in an adverse economic climate? Currently, you hear the common term feast and famine. Currently, public health is in a state of famine. With obvious economic crises, we've got some both present and looming budget cuts to public health, and how do the characteristics of health agencies affect their choices on how they impact that, and also how do these choices impact public health? Those are some real salient areas. Focus area 3 is financing. The financing really is kind of one of those areas of public health where we really realize there's not a lot of good data there. One question is, how can we best capture finance data? We still don't really have, I think, an adequate mechanism to really capture, to a very granular degree, finance data. Some of that's due to there's a lot of variation in how public health activities are financed between states and localities. That contributes to it. Another question, what is the impact of financial and economic characteristics of health agencies on health outcomes? How does variation impact population health? How does legal infrastructure influence public health agency financial status? And are there benefits from financial data harmonization through practice organizations? Those are some kind of salient questions. And really, our last area of focus is technology, data, and methods. One, I think, key question is, can health information technology positively impact health status? Another question that we've seen come up again and again is, how can we improve the capacity to collect and analyze data related to public health and the public health system? And really a key question in order to use data to actually inform policy and really improve public health is, how can we better translate the data we have to really influence, or to make it usable for policymakers to let them influence policy. And then, what data collection and use practices best support looking at how it impacts health outcomes? Those are kind of some key questions there. And with that, we'll leave it to questions and discussions with our moderator, Kara Richardson, who's our Assistant Director of Communications for the NCC for PHSSR.
Good afternoon, guys. I hope everybody can hear me correctly. I believe Rick and Aaron, can you hear me?
Yes. Yes, we can hear you.
Okay. I have 2 questions so far, and the first is, what happens if I am a junior faculty and do not have a PHSSR expert mentor?
Please, if you do not have a mentor, please contact me. My name is Jay Swacker again. My email, the program email address will be listed at the end. When you email me, just say, I need to get a PHSSR mentor. If you can provide a brief description of your research plan, that would help us out a lot. We've already had a few people contact us, and we are working through the information they give us, and we will provide feedback to them. One good source If you look on our website, publichealthsystems.org, you should be able to find a list of past PHSSR mini grantees and their mentors. It'd certainly be a great resource to start looking for them.
Okay. And just in the process, during the answer to that question, there was one that came in that I'm going to add in. It says, are there criteria for a PHSSR expert mentor?
We don't have any specific criteria. However, they need to demonstrate a past consistent engagement in the public health systems and services research community. One excellent resource as well, if you are able to attend the Keeneland Conference, there are normally quite a few hundred people that are involved in public health services and systems research at all levels. Or also, if you folks through the National Association of City and County Health Officials, or NALVO, or ASTO as well.
Okay, and I'll move on to the next question. I have my concept paper approved and will have my proposal discussed in the fall for approval. Am I eligible to apply? I plan to be a candidate by the start of the grant period.
So long as you are a candidate by the start of your grant period, that you should be eligible. If you are selected as an awardee, it may just be contingent upon receiving a letter that you successfully moved on to your candidacy.
Okay, and jump down. On the work plan template, do we use the key activity headings or can we replace them?
Please just go ahead and use the key activity headings that are provided in the template. We would like to keep all of the work plans that we're receiving from the awardees as uniform as possible.
Okay. And next is how do you define candidacy for the dissertation option?
Candidacy would just be, as we discussed earlier, you have presented your research plan to your dissertation committee and they have approved the research plan.
Okay. Questions are still coming in. And what can the funds be used for? Incentives for participants?
They are eligible to be used as incentives for participants. Mainly, the big expense is normally personnel, including the principal investigator's time. You may also use it for data analysis or software. There are some restrictions. We do not allow funds to be given to foreign organizations. We don't allow them to be used to purchase equipment or pay for rent or direct medical care or anything of that nature. Again, if you go to the program's website, which we will distribute to all of you, you should be able to find, and also on the online application system, if you look at the applicant references, there should be budget guidelines which will specify what costs are allowed and which ones are not.
Okay. The next is the Medicaid Analytic Extract, or MAX data, formerly known as State Medicaid Research Files, or SMRFs, are listed as a recommended PHSSR data set. Would comparable patient-level Medicaid eligibility claims/files obtained directly from a state also be considered as a recommended PHSSR data set?
I think it's important to understand that recommended isn't the only ones we would think about funding. So we will judge the applications based upon the merit of the research. So if it's a comparable data set and if what you're doing is PHSSR, then we would consider it.
Okay. And next is, could you provide some examples of measures of success that the research project narrative asks for?
The measures of success that we would be looking for, those would be, were you able to publish your research, or do you have a manuscript that we feel would be competitive in a peer-reviewed journal, and also attending the Keeneland Conference?
Really, they're dissemination-based metrics of success.
Okay. And next is, as I have already posed, this person has already posed this question, in some of their initial contact, I would like to use a local data set, a county data set shown, not shown at the suggested link, to answer some of the new PHSSR agenda, I think section 4A, and I am asking if this is feasible. And to Jay and to Rick, if that needs clarification, just let me know, and I'll respond back to the person that asked the question.
Again, I think, unless I'm mistaken, Jay, we have things we would prefer folks to use, but those are the only things they can use. If the application has merit, it's PHSSR, and the data source is viable, then I think we would certainly consider funding it. Is that?
That's certainly true.
Okay.
That's certainly true.
Again, you know, the data sets that we kind of recommend are recommended. They're not necessary.
Really, we just want to make sure that the data set can be used in some way to gauge the effectiveness of the public health system in the particular area. And that is indeed the focus of their research plan.
Okay. I think that kind of hopefully answers that question. And will you consider applications from individuals who are still junior faculty but beyond 3 years into their initial appointment?
No, I'm sorry. The cutoff will be 3 years after your initial appointment.
Okay. As I write the proposal and cite literature, are the references counted in the page count, or can the references be printed on a separate page, not counted in the proposal page, the page total?
Unfortunately, the online application system that we use only allows for a 2-page document limit when you upload your proposal narrative. The best thing I can tell you to do is to include your citations as a footnote and use a very small font, or use an abbreviated referencing system.
Okay. And will this great dissertation opportunity be available next year? I am about 1 month or so away from defending my prospectus.
We are planning on having another round. Again, this is contingent upon our continued funding from the Robert Wood Johnson Foundation. But we are currently planning for another round. And again, if you are 1 month from defending your dissertation, you may still be able to apply now if you foresee that your dissertation will be approved prior to the start of the award.
Okay. Kind of going along the line with that is, if they're outside of that, will there be other opportunities for additional sources of funding?
Yes. There will be there will be a larger call for proposals coming out from the National Coordinating Center here in a few months. I know one component of that is going to be Junior Investigator Awards, which will be structured similar to NIH-K Awards. These will be for a larger dollar amount, and I believe it won't be for dissertation. It will be for junior faculty, but I believe the time period is that if you are within 7 years of your initial appointment, then you will be available for those awards. And that is all part of a much larger funding initiative through the National Coordinating Center. And I know of other, there will be other funding initiatives, I'm sure, through the PBRN network and NNPHI and our other affiliates.
And I'll kind of add into that, most of you have heard about all of our funding opportunities through our website and through our social media, is to make sure to go to our homepage and sign up for the newsletter that comes in, as well as link to us in our group via Facebook and also through Twitter. And we make sure that we disseminate that information, whether it comes from our center or NNPHI or in Academy Health or any of the other groups that work on PHSSR issues with us. Okay. And next is, for the bio sketches of applicant and mentor, do you want us to include only publications pubs published, or those under review, for example, in press?
Yes, we would like for you to include under review or in press publications.
Okay. Is information regarding expectations of mentors for example, time, activities, etc., available to provide to potential mentors?
The only expectations we have are that they please attend the Keeneland Conference next year along with you all, and pledge that they be available to give you guidance on your research project throughout the award period.
Okay. And moving on, you mentioned that a literature review is one of the expected deliverables. Is there a specific format to follow, and what are the expectations?
Don't believe for dissertation candidates or awardees there is any specific format for the literature review. We will have a more stringent expectation for junior faculty candidates, but those would be negotiated or discussed in more detail if you are an awarded.
They may be very topic specific, so it may be more appropriate to make them a little more individualized.
Okay, and next, in the budget narrative, I am asking if we say 6 months as the period of award followed by the budget guidelines, although we will conduct the project equal to or longer than 1 year.
Yes, for this award program, the budget period is only 6 months, and that is what you should include in the budget, even though we hope that your research plan continues for longer than that.
Okay. And some more financial questions. Do the program costs have to match the spending deadlines? For example, can we incur $5K in Part 1 and $5K in Phase 2 for a total of $10K?
Really, these are just going to be 2 flat $5,000 payments to awardees, and we are really relaxing our post-award financial reporting requirements. The goal here is really we just want to reward those applicants who demonstrate developing and executing an exemplary research plan in PHSSR. We kept the budget narrative and budget requirements because we want to give applicants a kind of taste of the sort of activities they will need to do to compete for PHSSR funds on a larger stage. And we would want these to be reflective of the activities you plan on doing in that time period, but you don't need to stress out about making sure post-award that the resources that you use exactly match up to your budget. We really just expect you to complete the deliverables, and then you will get the full $10,000.
Okay. And continuing on in regards to budget, are there indirect costs allowed? Are these above and beyond the $10,000?
In RWJS guidelines, they have a flat 12% indirect rate. However, again, like I said, we just want you all to be able to set up with your institution to bill us for the 2 $5,000 payments. Post-award, we aren't going to be extremely nitpicky about making sure you're using it. No, but you won't be allowed to charge any indirect over and above the $10,000 award.
Okay, and that's what goes along with the next question was, are academic institutions allowed to include it in indirect cost? So
you may include it in your budget. Like I said, you can't go above the $10,000, and if you do include it, the maximum Robert Wood Johnson Foundation rate is 12%. And again, if you look budget guidelines on the online application system, it will detail how you are supposed to calculate indirect costs.
Okay, and another 2 more I think have come in. And can you use the funding to pay tuition, specifically dissertation hours?
Yes. Yes, you may use the funds for tuition.
Okay. And next is, does the 10K award include travel and conference expenses for the Keeneland Conference? Meaning, should we include that in our budget?
No, you do not need to include those costs in your budget. Those costs will be paid for or reimbursed by the University of Kentucky.
Okay.
I'd like to say that is also for 2 years, the initial award year, and then we will pay to bring you back to the Keeneland Conference in 2013 if you are awarded.
Okay, and continuing on, Several of the data sets in the recommended NLM subset, including NACCHO's local health department profiles, are available for a fee. Should this be included in the project budget, or will these fees be waived if the project is funded?
Most of those data sets come with fees, but also come with a waiver request. You can request a waiver of the fees. So you may want to contact NACCHO and send a data request form prior to you submitting the application so you can get the fee waived or not. But if not, then that fee would be included in the $10,000.
Yeah.
But again, they've been very understanding about limited finances in the past. So while we can't speak to whether they would do it or not, you might want to request a waiver and see how that works out.
Okay, and the last one I have that's come in is returning to the work plan. Can we keep the key activities provided and add rows, for example, specific components of data collection? And if I need to ask the person for clarification, please let me know.
No, I think if you could just include any, we would like to keep the overall structure of the work plan uniform. If you have any specific notes, please just note those in the body of the work plan.
Okay. And as this grant is anticipated to fund both doctoral students and junior faculty, will a specific number from each group be awarded?
No. We will we will select up to 10 applicants that we feel have proposed quality research plans. It will solely be based on the merit of the research plans and the feasibility of the study that is proposed.
Okay. And going back to the question in regards to the work plan, the person did clarify, and can an example complete work plan be supplied with all the codes?
Yes, that should be fine, I think.
Well, if it just, I didn't like if it doesn't go over, ask them to email you.
Yeah, if whoever that person is, just instruct them to send an email to me with a more specific question, and we can discuss that.
Great. Okay. Okay. And lastly, it goes back to one of the initial questions is, if I have a mentor who is not a PHSSR expert but nationally prominent in my field of research, is that acceptable?
You can have more than one mentor. We would still require you to have a mentor that is vetted as a PHSSR expert.
Yeah, again, with folks who are thinking about doing a dissertation, obviously you have a committee chair who is a mentor, who may not be a PHSSR expert, but we would also hope you would have someone who's a PHSSR expert to at least kind of consult with on your research. So you can have more than one. You can easily have more than one mentor, but one of them has to be recognized as a PHSSR expert.
Okay, and that's I don't have any more questions rolling in. If we want to open it back up, we certainly can, or there's definite contact. Jay Swacker with his email, I believe, is at the end of this presentation, and I will hand it back over to Jay and to Rick.
Okay, thank you very much, Kara. Thank you guys for all your questions. You really dug into the nuts and bolts. Hopefully we satisfactorily answered them. If not, again, please feel free to contact me. My contact information is up here. You can just shoot an email to phssr212@uky.edu, or you can call me at my desk there. Once again, quick summary, applications are due by 3 p.m. Eastern Time on October 13th. There'll be up to $100,000 available, and I wish you all best of luck. Yes, sir. That's $10,000 each, I should specify.
That's 10 grants of $10,000, not $100,000 per grant. Just to clarify.
Okay. All right.
Thanks.
Thank you all.
Thank you guys for participating.